You should do it on empty stomach. You stand like this and then breathe in and breathe out. Breathe out, breathe out, breathe out, breathe out without a chair. Breathe out, breathe out, breathe out, breathe out. Whoever has told you that statin will remove the block must have told you or taken you up the golden path. Now, this is a very simple exercise. This is very simple and it has two things it does. A, it helps your heart to have intermittent hypoxia. You know, every second, part of the second you don't get oxygen, the other half you get the oxygen. So heart gets stimulation and it produces the blocks and helps the blocks. And it's very simple. And at the same time, it exercises a beautiful muscle called Psoas major. It's a large muscle which starts in the chest at the back and comes down to the pelvis and holds on and comes and attaches itself to the thigh. So that if you stimulate this muscle, all the organs are stimulated every day in the human body. It's very simple. See, stand like this. Of course, now I've had a full breakfast. I shouldn't be doing it, but anyway, let me try. You should do it on empty stomach. You stand like this and then breathe in and breathe out. Breathe out, breathe out, breathe out, breathe out without a chair. Breathe out, breathe out, breathe out, breathe out. You should do it on empty stomach. You stand like this and then breathe in and breathe out. Breathe out, breathe out, breathe out, breathe out without a chair. Breathe out, breathe out, breathe out, breathe out. You should do it on empty stomach. You stand like this and then breathe in and breathe out. Breathe out, breathe out, breathe out, breathe out without a chair. Breathe out, breathe out, breathe out, breathe out. Stand up, breathe in, breathe in, breathe in. Now what have I done? I have breathed out for 20 seconds without oxygen going to my heart. And now breathing in. So intermittent hypoxia I have given. Number 2, I have stimulated my psoas. If you did it 5 times in the morning, 5 times in the evening, your blocks will increase. You don't want that, right? And you will live longer.
How about the stent part?
I didn't want to answer that. Actually, the stent will worsen the whole thing.
Or a bypass surgery?
No. Both will worsen the whole thing. Now, you live after that because of the placebo effect. You shouldn't live after that. Actually, bypass surgery is associated with double the risk of heart attack afterwards, quadruple the risk of stroke afterwards, sudden death increases afterwards, heart failure increases afterwards. Nobody tells you this. But your pain goes. Pain goes. Pain went without the surgery also, you know that. I gave you an example.